is this disease diagnosed? Well, the patient will typically show up in the emergency room or in the doctor's office complaining of shortness of breath and edema or swelling. And we'll do a chest x-ray, and typically the heart will be bigger on the chest x-ray. So that'll give the doctors a clue that we're probably dealing with heart failure. Then they'll go on to more specialized tests, like an echocardiogram, which is a sonogram of the heart, nuclear scans, which are stress tests, and a cardiac cath. And we inject dye into the pumping chamber of the heart, and we can actually see the heart move and calculate how well the heart's pumping. So all three of these tests can provide a number, and we call that number ejection fraction, or EF. And it's an estimate of the heart's pumping strength, or basically how much blood leaves the heart with each heartbeat. A normal EF, or ejection fraction, is 50% or more. So we'll kind of look at this again. Each heartbeat involves a squeeze or a pump, and each time, and then it also has a time for relaxation or a time for filling. So that's the cardiac cycle, a squeeze and a relaxation. When there's a problem with either one of these, the squeeze or the relaxation, we can have heart failure. So the weak pump, or the heart, where the heart pumping strength is less than 50%, we call that systolic heart failure, and that's what you guys typically know. That's the patient who is going on for a transplant, and the heart's big and it's weak. I've had some patients whose heart strength was 5% or less, and some patients who were pretty sick with a pumping strength of 30, 35. So you just don't know. Everybody's affected differently. And then there's also the type of heart failure with a stiff muscle. The muscle or the heart does not relax for good filling. So as the blood's returning to the body, the heart can't open up and accept the amount of blood that's returning. And so the blood backs up, and it can cause congestion. And we call that diastolic heart failure, or the more common or popular name for it now is heart failure with preserved ejection fraction. So symptoms that we want to recognize, because both of these types of heart failure will exhibit these, is a sudden weight gain. Now your patients at home or in the hospital will be looking for daily increments of 3 to 4 pounds in 1 or 2 days, or 5 pounds in a week, because that's rapid weight gain. You can't put solid weight on that quickly. But let's take a patient who's never been diagnosed, and they're home, and they come into the emergency room complaining of shortness of breath, or they're complaining that their legs are swelling, and they can say, I gained 40 pounds in the last month. I gained 60 pounds in the last month or two. We've seen all of it. But so they'll gain weight very suddenly. They'll have swelling in their legs and ankles. They'll have swelling and bloating pain in the abdomen. And typically we don't think about this as heart failure. And I'd always tell my patients that bloated, distended feeling is fluid building up in the belly. They'll have a loss of appetite. They'll feel full earlier as they're eating. So they're hungry, but they'll take a few bites and they don't feel like eating anymore. They'll have trouble lying down, and they'll need to have 2 or more pillows, more like 4 or 5 pillows, to lay back comfortably. And we call this orthopnea. You'll also find that patients will want to sleep in their recliners more often than get in their beds. These patients will be short of breath. This can be with just usual activity, or just if they do too much. So they'll be short of breath, like walking to the mailbox, walking to the bathroom. They'll park closer to at the grocery store because they're just more short of breath trying to get in. And then as the fluid builds up, the shortness of breath gets worse. And when they try to lay down at night and sleep, they may wake up 1 or 2 times very short of breath. And we call that PND, or paroxysmal nocturnal dyspnea. And what's happening is, as the patient lies down at night and the legs are up, that there's extra blood that's returning to the heart, and gravity is no longer pulling the blood away from the heart. So the heart's seeing more blood return, and that's a good thing, because that's why we wake up in the morning and we have our bladders full. But patients with heart failure, as this added blood gets returned to circulation, they become congested, and they wake up at night gasping for air. They may have a frequent dry hacking cough, especially if they lay down. So patients might tell you, I can lay down, but I cough. So once they lay back, they start coughing and they have to sit up. They may have fatigue with very little effort. And I tell my patients' families that we have no idea how much fatigue they have. If you can imagine carrying around a 20-pound bag of flour every day, all day long, you'll get tired. And that's how these people feel. I'm going to start with the daily weight. And I'm going to start this because we're going to bring it up over and over and over again during these modules that we'll talk about heart failure. And all patients must learn to weigh every single day. And those of us who provide health care must know that this weight is very important. We need to do the weights in the hospital. We need to do weights in skilled nursing facilities every day. We need to do weights, teach them to do weights at home, because the scale will see the water before they do. And what we're looking for is that sudden weight gain, and that's the sign that the kidneys are holding on to salt and water. We want them to weigh in the morning, after their first urination, and before they eat anything or dress. Teach your patients to write their weights down every day and keep a log, because if they write it down, they'll start to see similarities, they'll see a pattern, they'll see a range that they pretty much live in, and it'll just keep them abreast if the weight starts to go up, that they need to alert their doctor. We want them to call their doctor or office if they gain 3 to 4 pounds in 1 or 2 days, or 5 pounds in a week. Again, that's 3 to 4 pounds in 1 or 2 days, or 5 pounds in a week. That means that they're retaining water. A rapid weight gain is, again, due to fluid rather than solid weight gain, because we can't put solid weight gain on that fast. And typically, if a patient calls and reports a weight gain, the doctor or nurse will instruct them to take more of their water pill or diuretic to get rid of the extra fluid before problems really begin. It's a vicious cycle, and I'm going to kind of take you through a typical cycle in a patient's exacerbation. So fluid begins to build up, and their weight starts to go up. They begin to feel bloated. Their appetite tends to just kind of drop off. They get hungry, but again, they don't want to eat very much, because again, there's less room for food. Their stomach has swollen up and become edematous, so there's no room to put food in there. They'll become short of breath, and at first it's very subtle. They might feel like, oh, maybe I'm just tired, maybe I'm out of shape a little bit. It won't really catch their attention early on, but the shortness of breath gets worse and worse. Eventually they'll notice lower extremity edema, and their shoes will feel tight, or they're loosening up their laces. Men won't wear their boots because they can't get them on. And then the water pills that we use to get rid of the extra water will eventually lose their effectiveness. Because remember, I talked about gut edema or stomach edema, and that's where the pills get absorbed. And if there's an extra layer of water in the stomach, there's a barrier to the pills. So all the pills that they need to take are no longer getting absorbed properly, and they're being passed on. So now the water pills lose their effectiveness, and now their weight continues to go up. And patients can gain easily 8 to 10 pounds before they even notice other symptoms. So if they're not really watching that weight, they may totally miss it. So as time goes on and the weight's going up, they'll find that they're sleeping better. They're adding pillows to their bed to sleep at night. So they've added 3, 4 pillows, or they're lying in their recliner to sleep better. When they're walking and doing their daily activities, they're finding that it's just becoming a little more difficult to do that, and they can't walk as far. They might have been able to climb the stairs to the 2nd story, and now they have to stop halfway up because they can't breathe. And then as it goes on and they're not being treated, the swelling gets worse, the shortness of breath gets worse, and now they're only comfortable at rest. So just getting up and walking to the kitchen, getting up and walking to the bathroom is hard, and then it'll prompt an ER visit.